Hello, everybody. Good afternoon. And I know it's been a long day, but really inspiring. And so I want to thank you all for being here at the end of today. So my name's Lila Guirguis, and before I begin, I just wanted to say that I spent the first 13 years of my career in a family resource center in Highland Park, which is northeast Los Angeles. I was born and raised in Pasadena, California. And it was one of the first times I'd really ever experienced a sense of community. One of the most difficult places to grow children and to live in, it was Highland Park at the time. And yet we were in this big Victorian style house, and the workshop beforehand was all about environments. And so it just took me back to that time where I picked up kids in a 15-passenger van and from 3 different schools and took them to this, Victorian house that was built in 1912. And just how transformative it was. I didn't think about those kids as at-risk youth, but just 9 to 12-year-olds who really wanted a great opportunity and to be looked at as if that could be successful. But I'm here today to talk about a very different approach, the Magnolia Community Initiative, which we call an approach because we don't consider it a model, because every community is different, and that's really important to recognize that these are key principles that we are working towards and that we continue to learn from each other. But we're really trying to have a bold dream of improving the population of the well-being at a community-wide scale. So what does it mean to improve the well-being of a population? As organizational representatives, committed, invested residents, community leaders, we're working hard to make life better for everyone, but we're really not seeing things get better. So what are those challenges? A lot of us think that maybe it's just not our problem, but really we're in the same boat. So we have so many disconnected programs and services, it limits our collaborative and collective efforts. We're working on too many problems and ideas all at once, and focusing all our resources on getting a single outcome like quality parenting or school readiness or reducing childhood obesity, and we're putting all those resources into one outcome. We're focusing on policy without emphasizing the change in our everyday practice. And we call this the human and technical aspects of effective change, that we understand that it's hard to change practice. We've embedded in our education and our learning to do things a certain way. And so what are our local challenges in the community that I work? Poor health outcomes are very common. So 35% of children are overweight. 73% are not proficient in reading by 3rd grade. And 40% will fail to graduate from high school. So what's our approach? Well, the Magnolia Community Initiative is a voluntary network of 70 organizations and resident groups in a 5 square mile, 500 block catchment just south of downtown Los Angeles. So I tried to put up a little map of LA. And so our borders are around USC, and our most northern border is Olympic, which is in Koreatown. So we have kind of a unique opportunity to work with about 75% Latinos and about 13% Korean. And so it's a very diverse community. It's naturally divided by 2 major freeways in Los Angeles, so not a lot of neighborhood pockets, but some industry, the garment district. It's a very densely populated area. So in this 5 square miles, there's about 110,000 people living, and 10,000 children under the age of 5. So What did we do? So I was the founding director and came on board in 2008 and was really hired not knowing a lot about what I was in for. And so this voluntary network of partners came together, and one of the first things we did was develop a hope and dream. Was coming together because we were from different sectors, and so we needed something common that really connected us with one another. So this is our hope and dream, that the vision of 35,000 children living in the surrounding areas of South LA break all records of success in their education, their health, the quality of nurturing care, and the economic stability they receive from their families and community. And we really call these our 4 pillars and 4 goal areas that are actually grounded in research that really shows when families have success in all these areas, long-term outcomes are more positive for them and their families. So how do we realize our hope and dream? So one is really trying to act as an interconnected system. And I know that when I heard the word system, I really shied away from it because it's a scary word. And coming from the nonprofit sector, all you hear about systems is that they're complex and they're complicated and they're full of bureaucracy. But I think over the course of time, and absolutely working with Moira, learning that system isn't such a bad word, that we really can come together to accomplish our shared vision. And so I think it's important to note that this really includes our residents that are living in the neighborhoods, the services, the supports, and really how organizations link, refer, and follow up and interact with one another. What we're finding is that there's many fragmented services, and they're working with the same families, but they're actually not working together as a cohesive system. So what is it to work as a system to achieve population-level outcomes? Well, first we have to look at the complexity of people. So we're looking not at a person that's coming in for crisis, but we're looking at the person that is living in a challenging neighborhood, that has a family to support, that probably doesn't have a job, they might not have legal status, and no health insurance. So it's very complex, and so when we think about organizations, there's a lot of resources going in. There's government resources, and so we think about the resources aren't going to get, we're not going to get more money. We're only going to get decreasing money from our government to really meet increasing need. So how do we decrease this financial burden from costly systems that really start too late and don't have minimal results? And so that's why we do have this shift to prevention and starting early and looking at the early years and the importance of the prenatal to 5. But then looking at how do we impact, this is not program by program or service by service, but looking at prevention at a large community scale. So we work on common actions that cut across various sectors, so health, education, early childhood. We really look at, where do you hold the expertise? So this isn't where we ask people to hold back and compete and don't share your secrets of success, but really to say, no, bring that up, we want to share that, we want to learn. So looking at what to try with the expertise on how to change. And then we don't look at ourselves as using a traditional evaluation model, but we say, what can we look at immediately? What are the small tests that we can do to implement our promising ideas? So the thing that we always tell our network partners is, what can you do by next Tuesday to really see the change that you want to see? And so it has to be simple, it has to be manageable, and not an added burden to what people are already trying and doing. And then really acting as a network to produce and accelerate innovation and learning and spread. And really supporting a voluntary network, there has to be a way that you motivate people to come together and to really work with each other. And part of it is asking the question, well, what do you want to see change? What isn't going well, and what can you do to make that change? So we try to test promising ideas. So one is that, where we look at that 73% are not proficient at third grade. And so really recognizing that children are not getting the vocabulary or even that support in their family home that's really helping them be successful in school. So some of our partners are coming together, and we tried out a little bit of, okay, well, maybe it's more books that need to come into the family home. And we had physicians that were giving books out, and we had book giveaways, everywhere. And then said, well, maybe it's not more books. Maybe it's really about how do you create reading as a routine, like brushing your teeth. Like, how does it become part of the family norm? And how do parents really understand that this is something that can be done before bedtime? You can have a book in your purse, and you could do it at a doctor's appointment or while you're waiting in line or waiting for the bus. And that you can make books. Books don't have to be expensive. They can tell a story of the child's day. You can do it together. You can talk about pictures. So really looking at what are those key ingredients that support parent and child daily interaction that really stick for parents. And so this concept of network, it's, so we say if individuals and organizations are able to make their actions and activities and programs more transparent, so sharing, again, what you do, and visible to others, we could do a better job, a more efficient job on how best to use our resources and expertise in responding to family needs. And so Moira is going to talk a lot more about how we use data for shared learning and measurement and practice. But I just wanted to say that I think not only was the word system scary, but the word data was really scary. And so I think that it was really over time to think about, well, data doesn't have to be about what you're doing wrong. It really can be about a learning process. And so as I support, our network and bring people together, we often talk about putting data in front of people around what they said that they were going to do and looking at, well, how successful were they from month to month, and then sharing that across network partners and very much just sharing, like, well, what worked and what didn't. Some, it was a busy month and they just forgot. Some needed scripts to remind them, well, this is what we said we were going to ask about child development concerns, or we were going to ask about maternal depression. And so it was sharing of that, but just being more transparent about how we're all doing. And just if you don't know the word protective factors, this came from the Center for the Study of Social Policy in Washington, D.C. that learned about and did a study that the protective factors like social connection, parental resilience, social and emotional competency of children, the knowledge of parenting and education, and concrete resources were all protective factors that really help mitigate families against the negative aspects that might be occurring within their daily lives. And so we look at ourselves as really building this learning system to sustain collective action. So in the 7 years that I've been the director of the initiative, we've really gone through so many phases. One is really saying we're throwing out what didn't work. So it's a big philosophy of ours to really say we tried it, it didn't work, we don't have to stick with this. And that could be the infrastructure of our network or how we're working together or what we're trying out. But it's really a culture of cooperation and saying that this also takes leadership to help and support organizations. So I can't motivate, I can motivate partners only to a certain extent, and then it's really about the leadership of that specific organization that has to allow the direct service individuals or the services to move forward in their own innovation and their testing. So with that, I'm just going to show a little video that might just give you a sense of the other faces within the initiative.
All of these children in these neighborhoods, and so many of them are struggling.
Poverty is defined as being alone in the world, and how you belong and promote connection among families and service providers is critical to reducing poverty.
What would it look like to see all of these children succeed?
How do you help parents be well, families be well, neighborhoods be well?
To really create a tangible change in the quality of people's lives.
The overarching goal of Magnolia is contributing to the well-being of children, youth, and families. Where people are connected, they're contributing to their community.
You have a lot of initiatives that are focused on a particular issue, but what we're trying to do at the Magnolia Community Initiative is anchor these 4 different sectors: economic stability, health and well-being, early childhood and education, and the social services.
It started off with the concept we needed a neighborhood, and now our 500 blocks that holds the project is really maybe more than a dozen neighborhoods.
It's a system that we're designing to align the activities that people were already doing, but bringing in empathy, bringing in care pathways, different concepts that help people actually work as a system to change the family experience, which in turn changes the outcomes for the local population.
I think we have different components to really help navigate a family as to what it is that they might need.
There's Los Angeles County Departments of Public Social Services. There's a health clinic. There's the Children's Nature Institute.
We have the preschool. We also have an actual library here on site.
There's critical knowledge to be given on nutrition, on financial matters, on parenting matters.
I just did application for child support when she said, well, where can I get help with getting my resume together? The LIFT program is right beside us.
I have the opportunity to dialogue with people that in the traditional work world, I would send people off to them. I mean, I think that's what's really unique.
We're all collectively have the same goals in mind, which is to help families and empower them to be self-sufficient.
We've really moved away from this authoritarian approach and really saying, we know that you're struggling with this, let's meet in the middle and figure out how we can help you.
We all know that there are natural leaders within any community. We're fostering the relationship with these leaders, so we call them neighborhood ambassadors.
Muchas personas que no saben dónde acudir cuando tienen problemas, como nosotros que participamos en el grupo de embajadores, nosotros afuera llevamos la voz.
Initiative representatives have been working with the neighborhood ambassadors and other residents on things like belonging, on what it means to have social connections, what individual resilience is, and they've in particular been focusing on knowing your neighbor and being able to count on one another.
It's just a handshake. Hi, my name is so-and-so. Is there any way I can help you?
This past few months, there has been some burglaries in our community. Now we're keeping more of an eye to everyone's property. I'm building that trust so I could have that trust with them.
One of the things that we do with Magnolia Place is a family empowerment program, parents teaching parents.
We were all working together for one cause, and that was for our children, for them to have a better future.
Before grades, it's about consistency and predictability. So a neighborhood needs to feel consistent and predictable and safe.
That kind of goes towards this overall community change, right? Because then you're really changing what happens for generations.
I'm not just going in there as somebody who's providing services. I am learning and growing with the community.
The organizations, amongst all of them as a network, they're actually touching 89% of people in this geographic area.
We can feel and see the change that's happening. Other communities would choose areas of their communities to do this.
A lot of what we're doing is about sustainability, but also scalability. This is such a journey for us and not about a solution for a 5-year or a 10-year plan. This is across generations, doing things in a really different way in the long term. You could see a little bit of what it is, what we're trying to do, some of the different partners that are there. What I could spend probably another hour talking about is our community mobilization effort, and it was so great to hear about we actually call our community mobilization efforts the Belong campaign, and we launched that in 2012, and we go door to door and we host these parent or neighbor circles that is really about how do you introduce parents and each other, a lot of people. So you think about 110,000 people, but they don't really know each other. There's a lot of isolation, there's a lot of mistrust. And so, some of the things we do is really try to facilitate how do you meet your neighbors, exchange phone numbers, just be a support to one another. And from that point on, just connecting the most socially isolated individuals that are living in these neighborhoods. So I'm going to turn it to Moira, and she's going to talk a little bit about our learning system.
Great, thanks, and good afternoon. I wanted to share a few comments about how we're going about helping people be really designers and learners. So to get to a population outcome. So sorry, hope you're not getting sick. Okay, now it should be slower going forward. So I just wanted to start by, I think, referencing the conversation from earlier this morning, which was about what the point is of what we're trying to accomplish. And one notion that we've talked about is this notion of how could we minimize preventable loss of health, developmental, and learning potential in young children. And this is just one way of demonstrating that concept, which is a graphic that shows, in theory, if we arrayed all of the developmental potential that was lost in the first 5 years, and we put all those children who were losing potential into deciles, it's the children at the lowest end in that red category are where a lot of service systems in the US are focused. It's the 5 to 7% who have a special need, a chronic medical condition. The kids in green are the ones that maybe watch a bit too much TV, but they're generally okay. And it's that group in the middle that is really driving poor outcomes in the population. And those are kids that right now tend to fly under the radar because they don't have one thing. They have a combination of factors, and we have a very ad hoc system of services and responses to them if there's a response at all. So kind of part of the driving force is to think about how could we make the response to that group of families less ad hoc, more planned, more predictable. And how we go about it is that we also have some design ideas in mind. And if we were wanting to get to a population outcome, then we need to seek solutions that, first of all, work at scale. So if we start trying to do it from more and more places, it doesn't break down. That it can spread. So it's not just something that the most enlightened organization serving 5% of the population can do, but that it could spread to others. And it's sustainable, so that it won't degrade as our attention inevitably turns to the next topic or the next theme. So Lila shared this graphic about the boat, and a mantra that we talk about a lot is this notion that every system is perfectly designed to achieve exactly the results it gets. So if you want to know how to make sure that only 60% of children in secondary school graduate, come to Los Angeles and we can show you exactly how to do it, because we have a system that's perfectly designed to achieve that reliably year after year. And along the lines of what Lila was saying about a system, we try to use a simple definition of a system, which is that it's an interdependent group of sort of people or processes that are working together towards a common purpose. And what we've thought about is that changing the outcome means that all those interdependent people and processes need to work as a system to manage the care needs of a population. And those need to be developed, agreed upon, and implemented by all the relevant sectors, and everything needs to be designed for scale. So that's kind of our working theory behind the logic. Of course, this is not what your system looks like wherever you're from, but it probably looks something like this, and this is probably the easy version of the different sectors that relate to any outcome that you're trying to accomplish or any process you're trying to improve. A lot of players, not all at the same level of government or locality. And so the challenge that we have is that improving a system is different from improving a program, that we can plan and implement and evaluate programs, but we can't specify all the things that need to go into a system to make it work. It's not possible to be that specific. And once we get that specific, we tend to over-protocolize, and then people start doing the technical things and they lose the big picture. The other thing is we know that optimizing one part of a system doesn't optimize the overall system, so we need to keep the full system in balance, and a good example of that would be increasing referrals when you haven't done something on capacity at the other end or done something within the organization that's finding issues to figure out how you're going to handle the volume. And the other thing is that community systems are complex and never permanently fixed. There's always going to be a policy change or a set of new programs, or some programs go away. And so we need to have design ideas that are really robust, understanding that there are going to be those kinds of changes. And so the notion is to change outcomes for a population, we need an approach that sets a heading, but it needs to allow for adaptation and adjustment, and using testing to learn its way forward. An example you may have heard in complex systems is about how birds fly in a flock. Is that familiar to everybody? So it turns out birds follow 3 simple rules to do that. One is they don't encroach on their neighbor. One is they head basically towards the center of where their neighbor is headed, and they also look a bit ahead and move toward that center. And so you see enormously complex flocks of birds fly, and they don't crash into each other. If you tried to tell them specifically how to do it, make sure it's 6 inches and so forth, they'd crash and fall. So they use these simple rules to guide their action. So that sounds great. Why don't we follow the simple rules? Of course, the challenge is that'd be great in a flock of birds, but these are the kind of birds that we have. So then we have to think about, maybe it's not quite as simple as those 3 rules. And I just wanted to give another example that I think sets the ground for the kind of work that we're trying to do, which is this example from the movie Apollo 13, if you've seen that. So if you're familiar with the story, this is actually a story of the US that we're really proud to talk about. It was a great moment, where the spacecraft was approaching the moon, and there was a disaster, catastrophic damage to the main capsule, and they had to move to the attached module. But it turned out that the contractors for the government never thought about that contingency, so they had 2 different kinds of air filters for the different modules, and they weren't interchangeable. So the astronauts started running out of air. So there's this great scene in the movie where this poor engineer is holding up the 2 air filters, and he's saying, okay, we've been handed this one from upstairs, and we got to come through because the astronauts are up there running out of air. We got to find a way to make this fit that with what's on the table, because that's all they got up there. So we can't design the perfect solution. We have to design with what they've actually got in the spacecraft, and we got to do it pretty quickly. So that's kind of the challenge that we have. So one way we've gone about it is to try to think about what are the results that would tie together the efforts of all the partners in the network that would resonate with all of them. And those are long-term outcomes, intermediate and short-term measures that follow a specific theory that we have about how we think, what we think the mechanisms are for change. Those are linked to a set of what we call drivers, or concepts that organize the work, that tell people these are the 6 or so areas that we're all going to work on. And we use common language, even though when people go back to their own discipline or sector or program, they use their own specific language and jargon. And then we have some capacities that the full system needs, like how we use data, how we use improvement, leadership, and working as a network, and understanding also how people change. That everybody likes progress, but nobody likes change, and so we should expect that as opposed to hope that it doesn't happen. So there's a great TED Talk that's about the concept of prototyping, and if you haven't seen this TED Talk, it's really great. And part of what the talk is about is which groups actually test and prototype, and which groups find the perfect solution, and you might be surprised at the results. But the idea is that designers use testing and prototyping, and they use very small tests of change, and everything is a design process. So they ask the question of, what could it be like? What would it be like if we did the following? And then they test, and they test their way forward. And they don't implement too fast and see failure. They learn their way forward. And so the model that we use is very simple. This is what Toyota used to revolutionize the car industry in Japan in the 1950s. And it's the model for improvement, which has 3 questions. What are we trying to accomplish and when? How would we know that a change is an improvement? And what are the changes that we could make that will result in an improvement? What are our ideas? And the engine is actually the scientific method, which is, what's our prediction? What are we going to try? Let's do it, and then what do we see occur? And then what are we going to do based on that? And they're very small cycles of try it with 1 or 2 people, because we're trying to build a theory. And people have been taught how to do this incorrectly, which is you need a sample of 300. Right? You have to do it for 3 weeks, otherwise it's not representative. And so people actually haven't been taught how to learn in the way that industry and organizations and designers suggest that we do. So this is just an example of that, which is we do small tests, and then increasingly we do it under wider and wider conditions, more days of the week, more providers, more families, until we're more increasingly confident that what we're doing is actually achieving the goal that we thought. So I just wanted to speak briefly about measurement and then come back to an example of the change process. What we're trying to do with measurement is drive a change. So I'll give you an example of a couple ways that we've gone about it. One is we created what we call a dashboard, and this dashboard has a couple different areas on it. The idea is let's put our entire theory onto one piece of paper, put data onto it, and reserve at least half of the space on the dashboard for real-time measures of change. So the top has our ultimate goals, like reading proficiency, the early development index that you have here, the measures of protective factors, some family and community conditions, parent activities and behaviors, and then we have a set of processes that follow from the diagram, our theory of what we think we should change to get to a better result. And the last thing we have is a measure of what's our actual reach to children in the community to remind people that we can do great things and our data could look great, but if we're only reaching 1% of kids in the catchment area, we're not going to move a population outcome. So I'll just briefly just mention a few examples of how we use measurement, and this slide just follows in the examples that I'll show. So this is an example of giving insight where we show different measures of well-being. These probably look very familiar to you. So how well are families in the community? Giving some insight into that. Another example of how we use data is we try to encourage systems thinking. And one example is we'll ask people, so let's go through a process that we think probably happens pretty reliably. So a parent takes their child to the doctor and they have a concern about their child. How often does a parent like that leave a visit with a written answer or thought about what they might do? And people usually say, oh, 95%. Isn't that what healthcare's for? And then we think about, well, what actually might happen? What does it take? And we go through a couple steps, and I'm just going to fill it with probabilities. You might disagree, and hopefully you're doing better. But most of these actually come from real data that we have. And then we ask people, okay, now what do you think it is? And they say, well, probably 80%. We say, well, actually it's 2%. And that was a process that one provider basically controlled. Now think about the entire system. So how can we get to reliability for an entire population? And so then they start thinking about, oh, that means I can't do it right 60% of the time. I have to be 95% because there are 3 other people that need to touch this family and do the right thing as well to have a hope of having a good result. So it reminds people of why we're trying to work as a system. Another example is just asking the question differently, which is the old way we used to say is there enough access? Do we have sufficient clinics? And now we say, where are kids going for healthcare? And what's the quality? And we use small community surveys to actually profile clinics on quality. Or we might say, for the women who have depression risk in the community, what organizations are they actually connected with? So we do small surveys and then look at the network profile for those women. So again, it's stimulating people to answer questions that they haven't asked before. Another part of the learning is actually comparative data. So this is an example where we have 3 different sectors of healthcare, childcare, and family support, each in a different color. And then on the right-hand side, it's 4 different family support organizations. And we shared this data, and they said, wow, why is it that health is struggling so much on talking to families about local resources for social support? And then why is it that of these agencies, one is 100% and one isn't doing it at all? And when we actually shared this with the leaders of these family support agencies, the first response from the one that was at 0 was, well, we don't do that, so why would we be at anything beyond 0? And then he saw his companion of another agency who was at 100% and said, how did you do that? Got a short explanation and said, well, if that's all it takes, we can do that. That's not a problem. And now they're at 100% as well. So there's opportunities for learning within sectors, and there's opportunities for learning across. I just want to give one example of how we try to use data and learning to really empower people and organizations to take responsibility and ownership for the processes that they do control. Because if we have to create a program or direct people on every possible change, there's too much that needs to happen. So this is an example of several departments of public services in Los Angeles, child support, public social services that helps with health insurance and basic resources, for food and income, and then protective services as well, and then the city of Los Angeles. And their idea was, we see a lot of clients, we know a lot of them are very stressed, and by the time we've gotten through the interview, we can tell that they're really dejected and discouraged. And we could ask them actually, if you have, given that all we talked about today, that could make you feel sad, we're part of a network, we could help you with that, or some variation on that concept. But they didn't know how to do it. One person was a people person, and she was all ready to implement tomorrow, and the other person was more reserved, not quite ready. And so they used a set of tests where they asked very small questions. They started one client after another, very small scale testing until they were more comfortable, and then they went to scale, and then they were able to sustain it. So this change might not sound very exciting to you. So the question is, what question is exciting to you, and can we make this process work for more interesting ideas perhaps? So this is just an example of the Plan, Do, Study, Act cycle, just to show that they went through a prediction process to think about what they might produce, and then I'll show you their data. So this is the way we try to encourage people to look at data, which is they used to look at pre-post with 2 measures. Now they look at weekly or monthly data where they have small observations, but very frequently, because there's so much more statistical power from multiple small observations than there is 2 large comparisons. And you can just see over time the measures started going up, and they managed to sustain the process over time. And it's both asking about feeling sad and offering resources. Both of those things went up together. So that gave us a sense that they were moving in the right direction. And so this is the example of how we report data back to organizations. They can see a set of measures that they're working on over time, each measured monthly, all from the parent perspective of what parents experienced, small samples of parents reporting back. So I'll just conclude with this slide, which is there's a concept in the U.S. that came out of our Institute of Medicine, which dealt with the massive amount of error and harm that's done by our health system. And they described the notion of a learning health system with the idea that it's not just enough to clean up errors, but healthcare and discovery have to happen together. Science has to be part of daily practice. And that notion, I think, still applies to what we're trying to do, which is what's a population learning system, which is people need to be enthusiastic about what they're trying to do. They need some sense of what they're trying to accomplish. What's the theory that's based in all the science that we heard this morning? Co-designing the processes, because one system can't design their process and say, here's how we want you to act. They probably need to plan it a little bit more together, look at data together and plan what they're going to try. You think like designers and use small-scale testing to learn, and then increasingly increase, as their confidence increases that they are onto something, increasingly try under other conditions so that they learn how to scale, spread, and sustain what works over time. So I'll stop there and see if we have comments or questions. Thank you so much.